Good afternoon, members of Parliament, support staff, those in the public tribune, radio listeners, TV viewers, those following via social media, and members of the media. Welcome to this public meeting number 2, which is actually a question hour for today, Monday, September 25th, 2023. I would like to give a special word of welcome to the Honorable Minister of Public Health, Social Development and Labor, Mr. Omar Otley, and his support staff. We have established a quorum of 9 members. Please stand for a moment of silence. I have received notice of absence from 3 members, our chairman, MP Siddharth Bijlani, MP Angelique Rumou, and MP Sarah Westcott Williams. At this time, I open the floor for any member who wish to make use of notifications. MP Rolando Bryson. No, sorry. MP George Pantoflet was first.
Thank you, Mr. Chairman. Good afternoon to the Chair, my colleagues in Parliament, Griffier, our Honourable Minister of VSR and the support staff, Mr. Otley, person sitting in the tribune, those that are viewing. Mr. Chairman, I rise on this occasion to make 3 points, and one being I want to extend my deepest sympathy and condolences to the family of Mr. LaVey's. Mr. Louis LaVey's sister passed away, I believe it was on Sunday. So I want to take this opportunity to extend my deepest sympathy and condolences also to his sister Julie, with whom I had the privilege of working during our golden years at Mullet Bay. Mr. Chairman, it is not easy when loses a sibling, and I know that it's a very difficult time, so I want to ensure that I extend our deepest support to him and his family, of course, her children at this time. Mr. Chairman, I also want to, on a lighter note, congratulate the New Testament Baptist Church for celebrating their 67th anniversary. I had the privilege of being in that church in the 70s, so for me it was definitely a special time to be able to know that they're still going strong. And finally, Mr. Chairman, I was extremely happy to hear that the prosecutor's office has finally found the funds and the capacity and so on, Mr. Chairman, to pursue the issue with India, because I know I read somewhere where they said they didn't have the capacity nor the funding to do so. Interesting, I saw today when they said, yes, they are continuing a case, or the case that already started. It would be interesting to know when they started that case that they're continuing, because then they're contradicting themselves. At first they said they don't have the capacity, but now they say the case has already been started and it's continuing, so it would be good to know exactly when they started. But I'm happy to hear that they decided, definitely, Mr. Chairman, to pursue that case. Thank you, Mr. Chairman.
Thank you, MP George Pantoflet. Do we have any other member? I would like to make use of this opportunity before we go to the question hour. And it's probably an unusual notification or remark. It is interesting to note that right here, a few seconds walk, so to speak, from the police station where the old government building was, before we were terrorized by cars that were parking there. But since the demolition of the old building a fence has been erected, and along that fence, you have several signs that are saying no parking, and I even think one that says if you park, your car will be towed away. And coming here, I notify someone to assist me with parking that I'm approaching the police station and I should be here shortly, only to be caught up in a traffic jam. And then when you make a right turn to come down to the old government building to come through the marketplace or the taxi stand, there you're confronted with frustrated drivers who are coming from the direction of the old post office. They are driving on their right side but can't proceed because of the traffic jam. Those who already made that left turn or the right turn can't reverse onto the main road by the police station. So we have one disaster in Phillipsburg every day. And it's happening right under the noses of the police officers. I'm not pointing finger at anyone. I'm not trying to cry on anyone, but I'm just saying, please have something done about it. People need to be taught a lesson. If there's a clear sign that says no parking, but one that clearly obstructs the traffic, is violated in plain daylight. And then to add to that, when school is out by the Sister Borgia School, people are picking up their children. There is not enough space for them to navigate there, so they block the traffic, and we have an enormous frustration in town, and it's boiling over, which is not good for those of us who suffer from high blood pressure. There are better things to send up your blood pressure than a traffic jam. So I want to thank MP George for his notification, and I want to thank you for your indulgence in listening to my frustration. For today, we have as agenda for this public meeting, question hour. Questions from MP Melissa Gumbs, directed to the Minister of Public Health, Social Development and Labor regarding the status of COVID infections on Sint Maarten, including new strain infections. This was requested in incoming document 020 of the current parliamentary year, dated September 18th, 2023. And we go over to the agenda point. The intention of the question hour is to create the possibility to interact with ministers. After the passing of Hurricane Irma, Article 69 of the Rules of Order was proposed to introduce the question hour. During the question hour, only questions and answers will be given on the topic at hand. As we have had many question hours, I will shortly elucidate at this time on the procedure for the question hour. The Member of Parliament will get the opportunity to read his or her questions as submitted for a maximum of 2 minutes. This we find in Article 69D, paragraph 3 of the Rules of Order. The Minister is given the opportunity to answer the questions for a maximum of 1 minute per question, and this is regulated in Article 69D, paragraph 3 of the Rules of Order. The Member of Parliament is then given the opportunity once again to ask additional questions for a maximum of 2 minutes. Again, we can find this in Article 69D, paragraph 4 of the Rules of Order. The Minister is given 1 minute to answer each question in accordance with Article 69D, paragraph 4 of the same Rules of Order. The Chair of Parliament then may, based on his or her discretion, allow other members of Parliament to ask questions. They too are given 1 minute about the same topic, Article 69D, this time paragraph 5 of the Rules of Order, and the Minister is given 1 minute to answer each question, and this too is based on Article 69D also paragraph 5 of the Rules of Order. During the question hour, no permission can be asked to hold an interpellation, nor can motions be submitted. Today, Monday 25th, 2023, we have questions that were submitted by MP Melissa Gumbs. As I stated before, in incoming document 020 of this parliamentary year for the Minister of Public Health, Social Development and Labor. These questions were duly submitted in accordance with Article 69 of the Rules of Order. The Minister of Public Health, Social Development and Labor, Mr. Omar Otley, was invited by letter under outgoing documents 008 of the current parliamentary year. Therefore, in accordance with Article 69D, paragraph 3, Member of Parliament Melissa Gumbs will elucidate and read her questions to the Minister, and therefore I now give the floor to MP Melissa Gumbs. MP Gumbs, you have the floor.
Thank you, Mr. Chairman. I'll go straight into my questions. Minister, what are the current numbers of COVID-positive patients on the island? Are there currently COVID-positive patients in the ICU at the SMMC? If so, how many? And if how many of these patients have received the COVID vaccine since 2021? What is the protocol for handling and reporting positive COVID cases currently at the following entities: the general practitioners and the Sint Maarten Medical Center? Is there any ongoing tracing or reporting for visitors who test positive for COVID after leaving the island or while on the island? And what is the government's response protocol if new COVID strain numbers display a significant increase within the community? Thank you, Mr. Chairman.
Thank you, MP Melissa Gumbs, and I now immediately give the floor to the Minister to answer the questions in accordance with Article 69D, paragraph 3 of the Rules of Order. Minister Otley, you have the floor.
Has to be green, is on? Okay. Thank you, Mr. Chairman. Good day to the members of Parliament. MP Melissa Gumbs, I'll dive right into the answers. What is the current number of COVID-19 cases on the island? As of September 19, 2023, there were 3 active cases reported and registered. Are there currently any COVID-positive patients in the ICU at the Sint Maarten Medical Center? If so, how many? As of September 19, 2023, there were no COVID-positive patients in the ICU. What protocols are handling for reporting COVID? According to the Public Health Ordinance, SARS-CoV-2 is classified as a Group A disease. This means all cases, whether it may be suspected or confirmed, must be reported to CPS immediately. Is there ongoing tracing reporting for visitors? COVID-19 management and subsequently source and contact tracing has ceased since 2022. However, SARS-CoV-19 remains a Class A disease. Therefore, whether a visitor or a local is suspected or confirmed with the infection, the diagnosing physician is legally required to report that to CPS. What is the government's response protocol if new COVID strain or numbers are displayed in the community? CPS has a contingency plan in place for COVID-19, endemic and epidemic transmission. There are 4 scenarios: endemic, early phase, peak, and acute phase. The phases are defined by cases per day, number of cluster, hospital admission, and trends in positivity rate. The CPS will continue to monitor the influence of the new strain and these indicators to determine the appropriate public health interventions. In the endemic phase, the state-led interventions is encouraging vaccination for the high-risk group and the elderly and those with underlying symptoms within our community. In the early phase, continued intervention from the endemic as well as shielding from vulnerable groups and limiting mass gathering. What we decided to do is also, as you noticed during the height of COVID, is look at the hospitalization and the hospital capacity. What we see now in St. Maarten, many persons may be infected with COVID-19, are not reporting it. However, if it is verified by your doctor, the physician is legally required to report it. We don't have none but the 3 as of that date was reported by physicians. And as I often state, COVID-19, the reality of it is something that we are going to have to live with, like influenza, flu, common cold. And if we have 200, 300 cases with 0 hospitalizations, 0 deaths, and 0 in critical condition, then therefore we have reached, for lack of a better words, herd immunity, or we have something such as the influenza, flu, and so forth. Kindly note that as of March 25th, 2022, CPS shifted the case management to their respective patients back to the physician. April 29, 2022, community testing was no longer conducted at a national level. So I hope I've answered your questions. I look forward to any clarification, MP.
Sorry. At this point in time, I want to thank the minister, and I want to give the floor to MP Gumbs, who now has the opportunity to ask additional questions for a maximum of 2 minutes in accordance with Article 6090, paragraph 4. You may proceed, MP Gumbs.
Thank you, Mr. Chairman. And just one additional kind of follow-up question. The minister provided statistics as of the 19th of September is the 25th, and the questions were submitted the 31st of August. So I just would like to know, has there been any change, or did the minister check if there was any fluctuation in particular ICU numbers since that date? Thank you.
Thank you, MP Melissa Gumbs. Minister, you need a minute to verify? 2 minutes? Take 3. Meeting adjourned for 3 minutes. I adjourned the meeting for 3 minutes. It is now 4, so we turn the floor over immediately to the minister.
Thank you, Mr. Chairman. I would just like to make it clear to MP Gumbs, although you may have sent the questions in August, we received it September 17th. That's when I received my letter, September. That's when I have, so dated September 17th. So we immediately started to answer the questions, September 19th. However, based on the information provided, there's no cases at this moment known to CPS for COVID-19. So I would also like to state that along with the assistance of the GPs in May and in July, I also put out a public warning to the persons of St. Maarten, letting them know that the influenza flu is going around, and we also put preventative measures as well.
Thank you, Minister Omar Otley. And now I turn to the members of Parliament who are present. Does any member of Parliament have any questions for the minister regarding this topic? I look at the screen. I see the first member, Rolando Bryson, MP Rolando Bryson.
Thank you, Mr. Chairman. Mr. Chairman, both of the successive ministers of health in the Netherlands have pointed out at some point about the low vaccination rate that Sint Maarten has had. The fact is, Mr. Chairman, the vast majority of our population have chosen not to take the COVID-19 vaccine. And despite much of the criticism in the past, we see that we were still able to successfully make it through the endemic phase that we've been provided by the minister today. My question is, whatever was to happen, if there's a spike, will the minister continue to have the balanced approach with regards to COVID-19 and only implement a voluntary vaccine program?
Thank you, MP Bryson. Minister?
Definitely. I can only speak on a government level. I have to respect freedom of choice. So as long as I am here, I can say that we would respect freedom of choice, and also the vaccination would be based on your preference if you want to be vaccinated.
Thank you, Minister. And I look at the floor. There are no further requests. I want to thank the Minister and his support staff for being here. I want to thank you, members of Parliament. Ladies and gentlemen, we have come to the end of the question hour. I thank you all for your participation, and I hereby close this question hour.